Hello everyone, how are you today? I'm Dr. Paramjeet and you're watching Dr. Education. Welcome back to my channel. People have been asking me about lipomas and swelling, skin swelling. So today I'm going to talk about lipoma. As you know, all my videos are directly referenced from the internationally accepted US National Medical Library, and therefore you can trust this information. So before understanding what is a lipoma, you need to understand what are skin lumps and why, or what are the possible reasons for having a skin lump, a swelling. See, any abnormal lump or bump on under the skin is a skin lump, right? And most of these lumps and swellings are benign. Benign means non-cancerous. That means they are harmless, especially the kind of swellings which feel soft and they roll easily under the fingers, right? These are lipomas or cysts. So these are actually benign and harmless. A lump or swelling that appears suddenly over 24 to 48 hours and is painful can be usually because of an injury or an infection. So that is what you need to know. And then let's talk about what are the various reasons why you can have this kind of or any kind of lump under the skin.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
Obviously, one of the reason is lipoma. Lipoma means there is fat. There is a fatty collection, fat lump under the skin. Then that can be an enlarged lymph node also. Enlarged lymph node are usually seen in the armpits, the neck and the groin regions. Then cyst is another possibility. Cyst is basically a closed sac in or under the skin, can be inside the skin or can be under the skin, and which is lined by a skin tissue and it contains fluid, contains semi-solid material or fluid inside. That is a cyst. And cyst can be of various types. That is a different video. Then there can be benign skin growths such as seborrheic keratosis or neurofibromas. Neurofibromas are also benign skin growths. Benign meaning they are harmless. Then there can be boils, painful red bumps, which are usually involved the infected areas, infected hair follicles or a group of follicles, which are basically kind of like furuncles, right? There can be that because of infection. Then there can be corns or calluses. These are basically thickening of the skin in response to continued pressure. Like they are mostly seen in the legs, in the foot, and sometimes in the arms, like arms of bodybuilders or workers. You can see calluses. These are from shoes or from barbells, right? Dumbbells. These are usually occurs in obviously toes and foot. Then warts. Warts is basically caused by a virus which develops a rough, hard bump which usually appears on the hand or foot and often with tiny black dots on the bump. So if you have that tiny hard bump and tiny black dots on the bump, then it might be warts. Then there can be moles. Mole is basically a skin colored tan or brown colored bump on the skin. So it can be skin colored, tan colored or brown black colored skin bump. Then it can also be abscess. Abscess are infected fluid or pus filled spaces, closed spaces from which the abscess or pus cannot escape. So that's why it becomes abscess. Then it can be cancer also. Cancer of the skin usually presents. So it can be cancer also. Cancer of the skin. See, if there is a colored or pigmented spot that bleeds easily, or it changes shape or size, or it crusts or do not heal, that can be cancerous, right? If there is different colored changing colors, then that can be cancerous. So you have to see all these things, what kind of bump or lesion, skin lesion is there. If there is a skin lump which is because of an injury, that can be treated with rest, ice, compression and elevation. Okay, just don't move that area. You can cold compress it. You can actually compress it a little bit, not so hard, and elevate it above your head level, heart level, so that the swelling decreases over time. So most other types of lumps should be looked at by your doctor before you try any other home remedy, any other totkas. Make sure of that. Now, if we talk about the lipoma, lipoma is a non-cancerous growth. It is a benign growth of a fatty tissue, right? It has all fat cells. A lipoma can develop in almost any organ of the body, although they are most commonly found in the subcutaneous layer of the tissue of the skin just below the epidermis, that is the skin. So they are not in the skin, they are below the skin, and therefore you can move them and they are soft. So lipomas are usually soft under the skin, they grow slowly, they are non-painful, right? And they can be moved under the skin. So lipoma can also be associated with many other syndromes, many other diseases, but lipoma by themselves are harmless, right? But they can cause like cosmetic disturbances, psychological problems because of the lung, because of the lump, because how you look, right? So that is one thing. And if lipoma is actually causing a lot of discomfort, irritation, or any kind of psychological issue, you can actually excise it. You can take it out, right? A small incision, and you can take it out, then a few stitches, and you'll be good to go. So lipoma is normally not harmful, right? Only in a very rare situation where if there is a lipoma which is actually compressing on the nerve, which is just very near to the nerve, and increasing size of that lipoma can compress that nerve, resulting in weakness and sometimes extreme pain. In that case, this kind of thing is called adiposis dolorosa. So this condition where there is weakness and sometimes extreme pain, the amount of discomfort, irritation or pain from a growth of a lipoma depends upon where in body and what are the surrounding tissues or organs the lipoma is affecting. Ultimately, the treatment of lipoma is surgery, and there is a very rare risk of lipoma getting converted to liposarcoma, means a malignant tumor, but that is very rare. So that's all about lipoma. So I hope you are liking my videos. Don't forget to share and subscribe, and don't forget to hit the bell icon, because only then you will get the notification. I'm Dr. Paramjit. You're watching Doctor Education. Stay connected, stay healthy.